held esteemed positions as an expert committee member for both the Korean National Bioethics Advisory Committee and the National Hospice and Palliative Care Committee. He is currently chair of LC Committee for Korean National Bio Big Data Project, National Institute of Health, ROK. And his recent publications are on very important areas, including the public perceptions and attitudes towards bio big data, as well as the use of artificial intelligence in healthcare. Thank you, Professor.
Thank you, Brian, for your kind introduction. And also I want to appreciate for the organizer to invite me to these very important and very interesting conferences because I don't have much time, but 15 minutes is quite a long time for a non-native speaker like me. My attention level is just raising high up to, so I maybe mumble in the beginning, so you may have to wait until I become calm. So, my topic is about the ethics of novel interventions or unproven therapies for critically ill children. Currently, the use of unproven therapies is increasing because, as a background, there are a tendency of treatment research integration. In big centers in a developed country, many treatments and research is very difficult to separate. Many researchers or clinicians, well-known clinicians, are doing research too, and some of the patient is coming to those clinicians to be involved in the clinical trials. And I think it means some unmet needs exist in the patient side. Patients want to be cured or get access to the novel treatment, but it is very difficult to be involved or enrolled in a new treatment. And also there is an increased information for the patient. So it is related to patient advocacy groups or the patient themselves. Sometimes they provide information to their parents or to the patients. So it is I think it is a tendency of increasing the improvement therapies, but the data about the use of unproven therapies is quite lacking. I have found there are some articles about the current tendency or the databases analysis, but I don't think it covers all the unproven therapies quite correctly. Because it is related to the unproven therapy itself is quite diverse in its nature. It is sometimes it means that investigational therapies, sometimes it means the compassionate use. It is related to the United States law. And sometimes, especially some countries like Korea or some countries have well-developed alternative treatments, it means that unregulated therapies. And sometimes it is related to operable therapies. And even now, there is some tendency or some new terms for the unproven therapy by the WHO, like MEURI. It is potential use of experimental drugs in the event of public health emergencies. So these unproven therapies is quite diverse in its character. So it is very difficult to pinpoint where it is by what we mean by the unproven therapy. Anyway, the FDA listed the conditions for trying unproven therapies like this way. Patient life-threatening condition. Patient is very ill, and there is no other possible treatment available for them. And also, the unproven therapy or the investigational drugs shows some favorable risk-benefit ratio. And also, the risk itself is proportional to the character of the disease. Sometimes incurable disease, but it is not life-threatening condition, like the atopic dermatitis is a huge trouble for the mothers or fathers of children who has dermatitis. So sometimes the proportionality of the treatment and the disease itself is very important in the calculation. And also, FDA says that those use of unproven therapy should not hinder the development of the new drugs. So, as you see, it is related, primarily related to investigational drug use. But in the clinical practice, we see some parents talk about megavitamin treatment or the unheard, the oriental medicine or some herbal drugs or some everything. So in this case, these conditions will not very effectively work. So I think we have to distinguish some types of unproven treatment. One thing I want to emphasize is the use of unproven treatment is different from futile treatment. In futile treatment means that it is non-hopeful or unsuccessful. It is well known and by the established knowledge. But unproven treatment in itself, it is not well known or it is not established whether it will work or not. So, and I think it is related to the scientific evaluation of the proposed treatment. And there are some areas of prudence which is applied by the very, how can I say that anyway, the very sound judgment of the clinicians and by the discussion and agreement between parents and the physicians. And those things, because in many cases, we are thinking about using unproven treatment as unethical because it equals futile treatment. But we have to distinguish, I would argue, that it is very important to distinguish futile treatment and from unproven treatment. Then we have to think about why, when parents propose or ask the use of unproven treatment. Well, we have to think about the parents' motivation based on the qualitative research. Parents have some experience or some kind of frustration with the orthodox medicine. So they want to find another way. So the parent is quite assertive. It will work in my child. And so they search the web or the people around and found something, and they want to get the second opinion, especially from the trusted primary care physician or their attending physicians. But as we know that parent perspective is sometimes be confused or very difficult to make very objective decisions because they always have hope for the cure, and also they fear losing their children, and also they want to get opinions of others, and always they heard something from their relatives. Their grandmother has said something, friends say something. I saw this in the newspaper, I heard it from the TV broadcast. Just try that and ask your physicians. So they feel some kind of pressure. So try to do everything possible. And also they want to have enough time to be with their children, although they know they will eventually lose their children. And also they want to be a good father or mother to do everything possible. It is a cultural pressure, I think, or it is a universal pressure of parenting. But they want to be involved in the decision-making process. They want to be a part or the partner in the decision-making process with their physicians. So informed consent could be regarded as a doctrine or the paradigm. But always there is difficulties. I want to emphasize the difficulty. It is about the children, and children is developing in their decisional capacity. And also, as it is unproven, it means that we don't have enough data. And also, because it is life-limiting situation, always we are facing the existential limitations. They are fearing, they were curious, and they would want to do something. And also, we don't have well-established procedures to discuss this issue with the parent, or the third-party evaluation of the proposed treatment. So it's the difficulties of informed consent. But we are still regard parents as a proper surrogate decision maker because they have good knowledge of the child. And also, I think it is very important because they have interest in the child well-being. That's why we ask the parents. And also, I think it is somehow, we have to differentiate from they have interest, but they also bear responsibility of the child well-being, and they represent the child by their own rights. So I think it is something ethically unarguable, but something is ethically questionable things. So are parents very suitable for surrogate decision make? They may have therapeutic misconceptions. They are always pressured by the fear of losing, and also they are unprepared to uncertain nature of science. They don't know, but there are always some difficulties in the scientific literacy, and also they always feel the social pressure. So some people say that supported decision-making or shared decision-making, but I think the shared decision-making may not fit in the child-related issues sometimes. And because it is very difficult in its nature, and also we don't have enough data or knowledge, and also the parents have some difficulties in the decision-making. So we are come to a reality or the problem. Parents have some difficulties. Parents have some difficulties, and we don't have enough information, and we don't have the process to evaluate what will be our solution. But anyway, we need to get through these difficulties to make some progress. So I want to say is that process is important rather than decision itself sometimes. And also, sometimes we have to care their parents sometimes. And also we have to focus the decisional needs of the parents, sometimes the children included. And also during this process, we have to share the goal, information, concerns, and burdens. But to achieve this, we have some unsolved issues, like conceptual one or pragmatic issues. But I'm not going deep into these issues, but there is consideration. Sometimes it is very pragmatic, or the practical one. It should be distinguished from the conceptual issues. So this is the end of my presentation. Thanks for attention.